If you're over 60 and struggling with sciatica pain that shoots from your lower back down your leg, listen carefully. Because the real reason your sciatic nerve keeps hurting might not be your spine, your disc, or even your muscles. It might be something far simpler, a mineral deficiency that many doctors never test for. And if your body is missing this mineral, your nerves may not be able to repair themselves properly, which means the pain keeps coming back, no matter how many stretches or exercises you try. Hi, I'm Dr. Alex. I work with many seniors over 60 who struggle with sciatica and nerve pain. And today, I want to share something most people, and even many doctors, often overlook. Today, I'm going to show you how this mineral works, why it becomes especially important after the age of 60, and how restoring it may help calm irritated nerves and support the healing process. But before we get started, I'd love to know something. Tell me your age and where you're watching from in the comments below. I always enjoy seeing where our community is around the world, and it also helps me create videos that better serve you. Now let's start with something important. What exactly is sciatica? Sciatica happens when the sciatic nerve becomes irritated, inflamed, or compressed. This nerve is the largest nerve in your body. It begins in your lower spine and travels through your hips, buttocks, and all the way down each leg. When something presses on this nerve, like a bulging disc, tight muscles, or inflammation, you may feel pain that travels down the leg. Some people describe it as a burning pain, a sharp electric shock sensation, numbness or tingling, or a deep aching feeling in the hip or thigh. For many seniors, the pain gets worse when sitting for long periods, driving, or trying to stand up after resting. And here's something interesting. Many people try stretching, massage, or physical therapy, and those things can definitely help. But the relief is often temporary. The pain disappears for a few hours, maybe even a day, and then suddenly it returns again. So what's going on? In many cases, the underlying issue may involve the health of the nerve itself. You see, nerves are delicate structures. They rely on specific nutrients to maintain their protective coating and to transmit signals properly. Without the right nutrients, nerves can become inflamed, overly sensitive, and slower to heal after irritation. One of the most overlooked nutrients involved in this process is a trace mineral called copper. Now, copper doesn't get nearly as much attention as vitamins like B12 or magnesium, but it plays a surprisingly important role in your nervous system. Copper helps your body produce collagen, which is the structural protein that helps maintain discs, ligaments, tendons, and connective tissues. In fact, the outer layer of your spinal discs contains a large amount of collagen. If your body doesn't have enough copper, collagen production can weaken. And when collagen weakens, the structures that support your spine, including the discs, can become more vulnerable to wear, bulging, or irritation. That alone can contribute to pressure on the sciatic nerve. But that's only part of the story. Copper also helps maintain something called myelin. Myelin is a protective coating that surrounds nerves. Think of it like insulation around an electrical wire. When the insulation is strong, signals travel smoothly along the nerve. But when that insulation becomes damaged or thin, nerves can misfire and send pain signals even when they shouldn't. This is one reason people experience burning, tingling, or shooting nerve pain. And this type of nerve irritation can affect the sciatic nerve as well. Now here's where things become especially important for people over 60. As we age, the body's ability to absorb minerals gradually decreases. Your stomach may produce less acid. Your digestive system may absorb nutrients less efficiently. And certain medications can interfere with mineral absorption as well. Over time, this can quietly lead to deficiencies that affect the nerves and connective tissues. And because copper is a trace mineral, it doesn't take a huge deficiency to start causing problems. Even a mild shortage over many years may weaken connective tissues and slow nerve repair. Another factor that can contribute to low copper levels is diet. Many of the foods naturally rich in copper are foods that people don't eat very often anymore. For example, some of the highest natural sources include shellfish, organ meats like liver, nuts such as cashews, and dark chocolate. But in modern diets, many people rely heavily on refined grains, processed foods, and sugar, foods that provide very little copper. Certain lifestyle habits can also reduce copper levels over time. Excessive zinc supplementation, for example, can interfere with copper balance. High intake of processed carbohydrates, alcohol consumption, and chronic stress can also affect mineral levels in the body. So when someone has dealt with sciatica for months or even years, sometimes the issue is not only mechanical pressure on the nerve, it can also involve the body's ability to repair and protect the nerve itself. And this is why restoring key nutrients may support the healing process. Now, to be clear, this doesn't mean stretching and movement aren't helpful. They absolutely are. Keeping the hips flexible and the lower back mobile can reduce pressure on the sciatic nerve and improve circulation. But when the body also receives the nutrients needed for connective tissue repair and nerve support, the recovery process may become much more effective. In other words, you are addressing both sides of the problem. You're reducing pressure on the nerve while also supporting the body's internal repair systems. And when both of those factors work together, many people notice much longer-lasting relief. Now, in a moment, I'm going to show you some of the best natural ways to increase copper levels safely, and how some people are even using simple copper-based supports to help reduce inflammation around the sciatic nerve. But before we continue, let me ask you for a quick favor. If you're finding this video helpful so far, please take a moment to tap the like button and share this video with someone you know who struggles with sciatica or nerve pain. When you do that, it helps this information reach more people who may be silently dealing with the same problem. And trust me, there are millions of seniors who believe they simply have to live with sciatic nerve pain. But in many cases, the body just needs the right support to begin healing. Now let's talk about something practical. How can you actually increase copper levels in a safe and natural way? And how long does it take before people begin noticing improvements? Because this next part may surprise you, and for many people over 60, it can make a meaningful difference. So now the question becomes, if copper plays such an important role in nerve health and connective tissue, how can someone safely increase their copper levels? Fortunately, there are several simple ways to support your body. Let's start with the most natural option: food. Some of the richest natural sources of copper are foods that have been part of traditional diets for centuries. For example, shellfish, especially oysters, contain very high amounts of copper. Just a small serving can provide a large portion of your daily needs. Another excellent source is beef liver or other organ meats. While not everyone enjoys the taste, these foods are incredibly dense in minerals that support nerve and connective tissue health. If those foods aren't appealing, there are still other options. Foods like cashews, almonds, sunflower seeds, mushrooms, and dark chocolate also contain useful amounts of copper. Even moderate amounts of these foods added regularly to your diet may help restore mineral balance over time. But food is only part of the picture. For some people, especially those over the age of 60, diet alone may not be enough to correct a deficiency. That's because, as we mentioned earlier, mineral absorption often declines with age. In those cases, some people choose to use low-dose copper supplements under the guidance of their healthcare provider. Copper supplements are usually available in small amounts, often around 1 to 2 milligrams per capsule. For many people, that small amount may be enough to support normal levels. However, it's important to understand that copper must always stay in balance with other minerals, especially zinc. Zinc and copper work together in the body, and taking extremely high amounts of one without the other can sometimes create an imbalance. That's why many people prefer a balanced multi-mineral supplement rather than taking large amounts of a single mineral. And of course, before starting any supplement, it's always a good idea to speak with your doctor or healthcare provider, particularly if you take medications or have underlying medical conditions. Now, you might be wondering, how long does it take before people begin noticing improvement in nerve symptoms? The truth is that nerves heal slowly. Unlike muscles, which can recover within days, nerves often take weeks or even months to repair themselves. But when the body finally receives the nutrients it needs, something interesting can happen. Instead of the pain constantly returning, the irritated nerve gradually becomes less sensitive. Inflammation decreases, the protective myelin layer may strengthen, and signals traveling along the nerve become more stable. For some people, the first signs of improvement might include less frequent shooting pain, reduced burning sensations, improved flexibility in the hip or leg, or simply fewer flare-ups during the day. And when this happens, many people finally feel like their body is moving in the right direction again. Another factor that can speed up recovery is movement. Gentle stretching, walking, and mobility exercises help improve circulation around the spine and hips. This brings oxygen and nutrients to irritated nerves and helps reduce pressure on the sciatic nerve pathway. Even simple daily movement can make a difference. Something as small as standing up and walking for a few minutes every hour can help prevent the sciatic nerve from becoming compressed for long periods. Maintaining good posture while sitting and supporting the lower back with a cushion can also reduce unnecessary strain on the spine. When you combine these simple lifestyle habits with proper nutritional support, you create a much better environment for nerve healing. Think of it this way. Imagine trying to repair a damaged electrical cable. If the insulation is worn and the wire is under constant pressure, simply moving the cable around won't solve the problem. But if you reduce the pressure and repair the insulation, suddenly the electrical signal flows smoothly again. That's very similar to what happens when the body begins restoring nerve health. Now I want to share something encouraging. Many people believe that once they develop sciatica after the age of 60, they will simply have to live with it forever. But that is not always true. The human body has an incredible ability to repair itself when it receives the right support. Sometimes the missing piece is simply identifying the nutrients your body needs in order to do that repair. And when those needs are finally met, healing can begin. Before we finish, I'd love to hear from you. Tell me in the comments where you're watching from today, your city or country, and if you'd like, your age too. I always enjoy seeing our community from all around the world. It helps me create helpful videos for you. Don't forget to check out my previous video where I shared 3 simple exercises that can help seniors relieve pressure on the sciatic nerve. Many people have already found those movements very helpful. If you're over 60 and want to stay strong, mobile, and independent, make sure you subscribe and join our growing community. Thank you for watching. Take care of your body, keep moving, and I'll see you in the next video. And as always, this video is for educational purposes only and should not replace professional medical advice. If your sciatic pain becomes severe or continues to worsen, please consult a qualified healthcare professional. Your health is one of your greatest investments.